Hi folks, Dr. Kelly here. I heard you might be a little nervous about the abdominal pain session at the Sim Center. It's going to be great, nothing to worry about. When you go in, just introduce yourself, shake their hand, like a normal person. Ask them why they're there, open-ended question, although you know it's going to be abdominal pain. And the rest is all about OPQRST. My abdominal pain today is from sit-ups and a little deconditioning. But you would get that from the O, the onset, the exacerbating or provoking factors, the P, hurts when I change position, gets better with time and Motrin, the palliating factors, the time course, and then your physical exam would show some superficial muscle tenderness and guarding. But for your patients, same kind of thing. Have them describe the pain, that's the quality. Leave it up to them, use silence. They might call it stabbing or bloating or dullness or a toothache, whatever it is. Capture that quality. The severity, which is the S, scale of 1 to 10. The onset, what were they doing at the time? And have they ever had this before? And then the T, the timing. Does it come and go? Does eating make it better or worse? If it makes it better, maybe it's peptic ulcer disease. If it makes it worse, maybe it's gallbladder or biliary colic. And then you're going to ask associated symptoms. Your abdomen is connected on two ends. For this end, you're going to ask about nausea and vomiting. For the other end, you can ask about constipation or diarrhea and any bleeding. If they have bright red blood coming out of their rectum, that's hematochezia. And if it's black, that could be an upper source of intestinal bleeding like an ulcer, and that's called melena. Back to the R of OPQRST, radiation. Does it go right through to the back, in the middle? That could be pancreatitis. Does it radiate up or down on the right side? That could be, again, your gallbladder. And does it radiate down to the groin? That could be maybe a kidney stone. On exam, you're going to look for and report just a few things. General appearance. Are they doubled over or do they look comfortable? Vital signs. Look for any abnormalities. You can auscultate the abdomen if you want, but you're going to palpate all four quadrants. First soft in case they're uncomfortable, and then deeper, feeling for any focal areas of tenderness or any masses. And then you're going to percuss out the liver and the spleen, like we talked about in the physical exam class. And let's see. That's it. So it'll be easy. Remember, OPQRST, let the patient tell their story, be purposeful on your exam, and then when you present your SOAP note, don't forget up in the S, you want to include pertinent negatives. What does the patient not have? Maybe they do not have radiation of pain. Maybe it does not change with food intake. Maybe they do not have any melena or hematochezia. Stuff like that. Because then by the time you get to your assessment and plan, it'll be pretty clear by the case you've made what they do have by talking about what they don't have. Alright, good luck. We'll see you soon.